Unfortunately, of course, we ran a little over, and we don't have a ton of time to kind of talk about the Nurse and Allied Health Network, but I wanted to at least go through that and maybe at least have some people that have been actively involved kind of stand up so that you'll know who to connect with. There was supposed to be some sheets in the back, and I saw them earlier, but I have no idea where they are. For those that are interested in joining the Nurse and Allied Health Network, I mean, I'll be honest, you can be as involved as you want or as uninvolved. But one of the platforms that we have that we use, as was mentioned earlier, is this Mobilize platform. And so it's a bit like a Facebook platform where I think some people gave some examples of how are you managing, monitoring LFTs in patients with antifibrotics. You know, what topics are you using for support groups? You know, how are you managing issues around, you know, liquid oxygen? So I think that it's been a great tool. My goal this year is really to get more and more people using it. There's ability to kind of upload documents and those sorts of things. So Wendy was actually going to do this, but I think she actually has a conflict. But you know, Wendy really was probably one of the people to kind of get this started, and it probably came about through the summit. And again, many of the faculty have been very actively involved in the different projects. But I think currently we have about 87 people who are registered, and this is based on through this Mobilize platform. And again, you know, if we can find the sheet, just, you know, put in your email address. Some people have had some issues around their institutional blocking things, and so we can kind of help you through some of that. We keep saying we're going to do an actual like tutorial, but it's mostly self-explanatory as to how to use it. But you would get an invitation from Mobilize, and you would just accept that. And again, we talked a little bit. It'd be great to get some different specialties, like, you know, pharmacists and, you know, social workers and different people engaged. So that would be great. Let me see here. So, you know, obviously the Nurse and Allied Health Network is kind of under the whole umbrella of the Pulmonary Fibrosis Foundation. And so these were topics that I think we had a meeting, as we talked about, in Nashville. Was it Nashville or Chicago? Okay, Nashville. And so these were ideas that nurses thought were projects that they could be involved in and really make an impact. So we do a monthly journal club, which again, Lori from University of Michigan actually has been really spearheading. And it's really, to me, it's great because it forces me to read an article. And I should be much better about that. But it really has been great. And a lot of the publications have been what I would say are really nursing-focused issues. The problem, of course, is that not many nurses have the same dedicated carve-out in their day to take an hour to do a journal club. So we're really kind of struggling with that. You know, do we go to a half an hour? We've sent out a poll. Is Mondays better? Is Fridays better? Or morning? You know, so even, you know, sometimes I know like Jennifer and Carolyn at 7 a.m. in Washington, and okay, maybe they can do that before their clinic starts, but on the East Coast, it's, you know, it's 10 a.m. and so people are in the middle of their day. So, you know, is it worth us archiving these, recording them? You know, should we do something almost like a chat where we talk about the article and people respond? So, unfortunately, again, we're not going to have a ton of time, but I would love to get people's ideas about how we can really kind of continue to grow this. So then the patient handbook, and I don't know, Janelle, and Ann, do you have any kind of quick comments? But so you guys just stand up at least so they know. Sorry, Wendy, I took over here. So these two are involved in creating a binder, and I'm sure many of you have this. You have a patient that's newly diagnosed. You're handing them all these pamphlets and brochures, and it's just a way of, I think, consolidating all of that. I think they are working. As I think you would say, we have lots of materials on the PFF website, kind of consolidating all of that. So again, if you have an interest in getting involved in that, talk to either one of those two people. And then the nurse mentorship program. This has been a bit of a struggle for us, and I think it's a really important idea. You know, I've gone out and I've met with nurses or respiratory therapists or whoever that are pretty new in their career in pulmonary fibrosis, and they just love to be able to pick up the phone and call Susan and say, how are you doing this? Or, you know, call Carolyn and ask, you know, how are you dealing with the issues around, you know, antifibrotics? So is there a way we can almost just assign, you know, people sign up and say, I want to be a mentor? and somebody else said, oh, I want to be menteed. I think that's the right way of saying that. But, you know, we even thought about doing things like physicians do, where you have like a visiting opportunity where you can go spend a month or 2 weeks with Wendy at Vanderbilt. There's some challenges around that. You know, now, back in the old days, you could probably go and, you know, I think about even, I came from the pharmaceutical side and I could walk all over the hospital. Well, you know, those days are long over. So there's issues around that. And then, of course, there's issues around funding. Where fellows and things, there's separate funding for them to go and do these visiting, you know, internships. But the two pharma companies are very interested in nursing education. So I think there is some opportunity if we can work through some of the red tape of that and actually getting people to be able to spend some time. We were just talking a little bit about the PHA, where they go out, you know, they do kind of regional events where they do more didactic kind of training. I think there's some opportunities for that. I'm hoping you all think this was a successful day, that we can reproduce this next summit. We do have an annual volunteer meeting that occurs kind of on the off years, and I would also like to do it during that meeting as well. So I think there's some opportunities. So the summit program, again, you know, most of the presenters were involved in the planning of this meeting, so really I have to thank them for the success and the great faculty and the topics. So again, my guess is they may think their job is done, but before you know it, they're going to have to start thinking about doing this for the volunteer meeting. And then I think something that's really interesting to Wendy and others is this idea of research. I mean, she's doing a lot of things, you know, in her center, looking at kind of, you know, not quite, you know, following up on telephone calls with patients, and does this make an impact, or, you know, things around looking at oxygen. And so not all research is pharma related, and, you know, are there some projects that we can do that nurses would like to be involved in at their particular center. So I think we probably have about 15 minutes, and, you know, I don't know if we can kind of, Wendy's in the back there, and so we can, if people kind of want to talk to her about that or have some other ideas. So I think I just kind of went through all of these without that. But so other ideas of things that we can do as as a nurse and allied health group. We're really interested in that. How do we get people more engaged? You know, there's, you know, it's the hard part, of course, is you guys are all volunteers, and I can't thank you enough for the work that you all do, not just for patients, but for the organization, for the foundation. And so, you know, it's hard for me to come and say, this is a list of 20 things that we'd like you to do. But one other thing, too, just kind of quickly, is something we've done with mostly physicians, but there have been nurses involved in these. We have these position papers, and we have picked topics that we think are fairly pertinent to the community right now. One of them was around genetic testing and counseling. My guess is you have a lot of patients that come to you and ask, should I be tested? Should my kids be tested? And then another one was on surgical lung biopsy and kind of what are the benefits and risks of doing surgical lung biopsy. We had also an updated paper on stem cell treatment, which I think was very well done. And then we had a working group that actually came up with kind of a standardized protocol for doing HRCT images. So one of the things that we had on a question up here was some ideas around maybe a position paper that could be unique to this group. You know, whether, again, it's oxygen. Oxygen, obviously, to me is something that you all deal with far more directly. I hate to say, most physicians will tell you they know very little about oxygen delivery, and, you know, they know the challenges just because they've heard it. But, you know, are there topics like that? You know, something, Kathy's not here, but something on palliative care. They're intended to just be kind of a short document. They're not at the level of a guideline. We call them, you know, we kind of say it's a perspective. You know, but there are topics out there that people have a real interest in that either the published data is not particularly clear or there's just no data on it. So the surgical lung biopsy, the HRCT, the stem cell are all on our website. We're working through kind of the final kind of nuances with the genetic testing. We think that's something that patients will read, and it's geared to a healthcare provider level. So we're trying to create something that's a little more geared to patients and creating like FAQs. So anybody have any quick comments or ideas? Yes. Yeah. That's great to hear. Yeah, I mean, I think it's a great way of communicating. Ultimately, we'd like to get the whole network on this mobilized platform. Right now, it's really only this group. We're trying to get, we also want the physicians, the directors, to communicate as well. So that's something that we're actually going to talk about here. Go ahead. Right. That's great. We're again trying to figure out things. Even if we did journal clubs, we had talked to even briefly, could we create like CE or CME credits around that? Would that inspire people? It's not necessarily always the easiest thing to get accreditation. And even for this program, it's Jennifer can tell you it's a lot of work to get the various different accreditations. So, Wendy, do you want to add anything?
A doodle poll to find out maybe when the best time is or things like that. But if all you can do to get your feet wet in this is to be a part of journal, you will learn invaluable things every time. So we've done 5 journal club meetings so far. We've talked about oxygen. We've talked about the RAP IPF study. If you don't know about that, that's because you weren't on journal club. We've talked about IPAF. And we've talked about patient needs in IPF. So every time we have a meeting, we cut that paper up, but we also examine what more could we do? What are the next steps that we could take that paper and move forward? And I'm always enriched by what I've learned just by sitting down for 45, 50 minutes with my peers and really kind of diving into one paper. So it's not, I don't want to say it's an over-engrossing thing. Just skim through the paper before you call in, and then just share your thoughts. So Janelle and Lori have been really great on this part of looking up at papers and things like that, but we can't do it without you. None of these programs that Pauline have talked about, they're all here for you, and we want your suggestions on what else we can do, but we can't do it without you. So there's a piece of paper here to sign up on. Put your name on this, but go beyond this piece of paper and be a part of the committee. This is your group, and we want to make you strong so that you can go impact your patients. So that's all I'm going to say about that. Thank you for being here.
Yeah. I mean, I wish I had actually put my email up here just because it's Bianchi, Bianchi at pulmonaryfibrosis.org. But again, unfortunately, this isn't the best environment to kind of sit down and share ideas. But I would love for you to send me ideas. Again, if we get you to sign up in the back, we'll get you on Mobilize, and there's just is an easy way to communicate with that. We do have, I think we have a cocktail reception tonight, right, with the posters. So obviously, it's going to be hard for us to all. You saw us trying to take one picture, so that it might be a little challenging for us all to sit around one cocktail table and have a drink. But I would encourage you all. This is a great opportunity. Again, anyone that's newer in the field, you have the world experts in nursing and allied health here, and I would encourage you to make connections. The one thing I have found overwhelmingly is the willingness, I'm getting goosebumps, of these people to really help and foster patients as well as people in the field with caregivers. So again, look at the people around, and like I said, please reach out to me, and we'll keep this going. We do try to meet even at things like ATS and CHEST, but the same thing as a lot of nurses don't get that time. And I know really struggles with getting kind of that carved out time, and most nurses do. But there's at least opportunities there. And like I said, let's think about some other opportunities where we can gather as a group, because I think we have a lot of strength, and we make a big difference, I think, for patients. So kind of last, I think, we have actually a couple minutes here, but I have to remind you again about the badges, so don't leave your badge or they're not going to let you into any of the sessions. So if you are currently part of a Care Center Network site, you should be attending the next session. So it's usually a nurse, 2 nurses, the director, whoever, coordinator usually attends that. And it's kind of a brief overview of what's going on with the Care Center Network sites. We have a lot of working groups within the Care Center sites that you kind of hear an update on what's going on with those. And then we're going to give an update on the registry as well, because even if you're not a Care all of the registry sites are Care Center sites, but not all of the Care Center sites are registry. But you should still stay for that, because we're hoping to obviously expand into Registry 2.0. So there may be some opportunities for sites that are not currently participating in that. I think there were some issues around the room. So in case you have it at a different location, it's now been moved to the Grand Ballroom D, E, and F, which is down the escalator to kind of to where more of like the big the big meeting rooms are down there. So, any questions? Anything last minute? Yeah. Yeah. So that again, if we're going to do this again, we don't want to reproduce the exact same materials. So if people also want to make some suggestions for new topics for a meeting like this, again, topics for Journal Club, topics for position papers, any of that would be great. So, no, go ahead.
What about continuing education? How do we sign up to get the hours for that?
You should, I think, automatically, if you are registered here, you should probably get an evaluation at the end of it, and you'll get credit for the, I think it's 4 hours of CE credits or CE. I think that's how it will work. So. Yeah. Do you know that, Jen? Will they get that, like an email from Globe? Okay. So at the registration table, thanks, Jen, that there'll be a form that if you need continuing education credits. They have the information down there. Okay. Okay. Or in the brochure. Yeah, go ahead. So that's, again, for those that are if you're outside of the Care Center Network, then it would not be a meeting that you would be involved in. It's those nurses and physicians that are part of currently the 68 centers in the U.S. So. No, it's not. So it's probably a closed meeting, kind of like this was kind of separate. So, yeah, so it's probably not on the general agenda. So, okay. Oh, that one is now moved to the Grand Ballroom D, E, and F. D, E, and F, down the escalator. So, okay. And thank you guys so much. You were fantastic. I hope you guys enjoyed it as much as I did, and hope to see you tonight at the cocktail reception. So, thanks.